Good afternoon, everyone. This is Dr. Val R. Cush, Chair of the Montgomery County Board of Commissioners. I'm here today with my fellow Commissioner, Ken Lawrence. Today is Wednesday, December the 9th. We are in week 40 of the coronavirus here in Montgomery County. As we continue to navigate this very challenging situation, I want to remind everyone that we are all in this together. The choices that each of us makes regarding our personal conduct, whether or not we wear a mask, attend private social gatherings, answer the phone when a contact tracer calls, and how we plan to celebrate the upcoming holidays impact all of us. Our Montgomery County hospitals have more patients hospitalized with COVID-19 now than they did in the spring. While the hospitals are better equipped with PPE, ventilators, and medications that can ease the course of the disease, they are all facing critical limits in the number of staff they have available to care for patients. All of our hospitals have been impacted by staff who have been exposed or infected in the community due to the substantial amount of virus circulating right now. Each day since last Friday, between 2 and 4 of Montgomery County's 9 acute care hospitals have been on divert for 4 hours or longer. As a reminder, being on divert means that the hospital emergency room is full, and the hospital is asking ambulances to take patients to a different hospital. When a hospital is on divert, that means that if you call 911, no matter what your medical emergency, you may not be taken to the closest emergency room. Additionally, this is impacting our entire region. Hospital capacity is strained in our surrounding counties. Bucks County, for instance, has approximately 1.4 beds per 1,000 residents, or a total of a little over 1,000 beds in their hospitals, compared with 2.6 beds per 1,000 residents, or about 2,150 beds in Montgomery County. So when any of our neighboring hospitals go on divert because they are full or having staffing issues, those patients may be diverted to a Montgomery County hospital. Many times you've heard me talk about the amount of virus circulating in our community. Today, we've put together a visual comparison of your chances of running into somebody with COVID-19 on June the 26th, the day we entered the green phase, and the day that we were at our lowest 14-day average, compared with today, December the 9th. On June the 26th, which is depicted on the left side of this graphic, we had 443 cases during the past 2 weeks. If we divide this number by the county population of 830,915, we get 0.053%. If you express this as a fraction, it is 1 in 1,875. In other words, you would encounter one positive individual for every 1,875 people you interacted with. And that one positive individual is the single red person down at the bottom of that graphic. Today, as represented in the column on the right, things are much different. We have had 5,359 cases in the last 14 days, many of them due to the post-Thanksgiving surge. Using this same math, you would likely encounter a positive individual for every 155 people you interact with. This graphic only shows PCR confirmed cases and does not try to account for the likely many other untested but positive individuals in our community. Each of us has the power to improve this situation by making choices that will reduce the spread of the coronavirus. Please keep the following facts in mind. The CDC is determined that over 50% of transmission of the coronavirus is by people with no symptoms. The virus is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Multi-layer cloth masks that do not have a valve can block 50 to 70% of these respiratory droplets. Cloth masks do prevent transmission of the coronavirus. Consistently wearing cloth masks and maintaining 6 feet of distance from anyone who is not part of your household, whether you are indoors or outdoors, will have a big impact on reducing spread, protecting you and your family. Avoid social gatherings with people outside of your home. If you can work at home, please do. Avoid carpools if possible. And if you can't, each person should wear a mask and the windows should be open for the entire drive. Keep your hands clean and away from your face. And get tested if you need or want to, particularly if you're thinking about traveling or you have just returned from travel. And please cooperate with contact tracing if you get called. Since our December 8th press release, we have had 239 cases of COVID-19 reported in Montgomery County, which brings us to a total of 24,658. These positive cases are a result of a positive test for the virus, not from the antibody test. 6 of these were from a long-term care facility. 1 was from the Norristown State Hospital. 1 was from a different congregate setting, and 231 are from the community. 226 of these tests are from the last 7 days or less. 12 of the tests are from 8 to 14 days ago, and 1 test was from more than 14 days ago. These positive individuals are from 53 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 5 months old to 95 years old. And as always, you can check our county map at www.montco.org/COVID-19 for updated geographic information. Today, we have 130 females and 108 males and 1 unknown. I'm very sorry to confirm that 14 additional Montgomery County residents have lost their life to COVID-19, which brings us to 908 deaths confirmed positive from COVID-19. 10 of these individuals died at a hospital, 3 in a long-term care facility, and 1 in their residence at home. They ranged in age from 45 to 93. Overall, we've had 478 females and 430 males lose their life to this disease. And in total, they have ranged in age from 34 years old to 104 years old. The self-reported racial breakdown of individuals who have passed away from the coronavirus, if we have it, include 1 American Indian Alaska Native, 21 Asian, 4 Asian Indian, 3 Asian Korean, 111 African American or Black, 392 white, and 376 unknown. Of note, today we report the first death of an individual who identified as American Indian or Alaska Native. As we've discussed many times, increases in deaths lag behind increases in cases. Today is the first time that we've reported deaths numbering in the double digits since June the 10th. Put another way, the 14 deaths that we've announced today is more than we did together in the months of August and September, which combined were 13 deaths. Our positivity rate has ticked upward again this week. Our 14-day average positivity rate is 9.73% as of Friday, December the 4th, compared with 7.95% as of Friday of November the 27th. As a reminder, on this graph, the orange jagged line is the number of daily PCR tests performed, and then the blue line is the 14-day average positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph, shows the daily positivity rates from November the 21st to December the 4th, and shows that the county was above 5% on all 14 of those days. As I mentioned earlier, hospitalizations continue to increase. Today, 539 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is an increase of 177 individuals from last Wednesday, when we had 362. And as I said earlier, I believe this is the highest number of individuals that we have had hospitalized during this entire 40 weeks. 10% or 53 of these individuals are requiring a ventilator. And as a reminder, we have information on daily hospitalizations and ventilator use on our data hub at www.montcopa.org/COVID-19. For the 14-day period ending December the 4th, 57,705 Montgomery County residents were tested for COVID-19, which is an increase of 2,959 people tested compared with the 14-day period ending November 27th. So this is great, and certainly we want to make sure that people continue to get tested. So this is our date tested graph, which we show you every week. As a reminder, the gray bars are the number of positive cases on that particular day. The darker red line is the total 7-day average, the total of all the cases in the county, and the pink is the total 14-day average. The dark blue is the 7-day average just from the community. The light blue is the 14-day average just from the community. And then the orange and yellow lines at the bottom are the 7-day and 14-day averages from our long-term care facilities. And you can see on this graph, we've noted Halloween and Thanksgiving. And we're now going to zoom in and show you the impact of the Halloween and Thanksgiving holidays, during which there were many private social gatherings. You can see the uptick following Halloween. Then, just as that surge started to level off, it was the Thanksgiving holiday weekend, and we have been experiencing an unprecedented surge in cases since then. By date tested, we have had our 3 highest days during this 40-week pandemic on Monday, November the 30th, when we had 654, Tuesday, December 1st, when we had 557, and Wednesday, December the 2nd, when we had 540. As you make plans for the upcoming holidays, please consider the impact that the Halloween and Thanksgiving holidays have had on our community. I do remind you that there is light at the end of this tunnel. In a few short months, there will be safe and effective vaccine available for our community, but we need to hunker down between now and then in order to protect our hospitals and first responders. For those elected school boards across the county that choose to offer in-person education to help keep our positivity rate and incidence rate of new cases as low as possible to minimize risk to students, teachers, support staff, and bus drivers. And to support those businesses that are operating safely, are following all the mitigation measures, and are not known sites of COVID transmission to continue to operate. I want to shift to a contact tracing update. As has been the case for the last couple of weeks, due to the very large volume of cases, the contact tracing team is no longer able to call everyone. So they are prioritizing in the following ways, which is aligned with the guidance from the Pennsylvania Department of Health. We are prioritizing persons 18 years of age and younger in order to assist our schools for those that do wish to have in-person education. We are prioritizing persons 65 years and older, and then persons who are part of a community or household cluster. Also, if you were exposed at a school, through a sports team, or at your workplace and need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. So if you believe that you may have been exposed through one of those locations, please check your email regularly. We continue to have good availability of testing, and I want to urge anyone who wants or needs to be tested to get tested. We have expanded our testing site hours to 9 a.m. to 5 p.m., Monday through Friday at all 6 locations. I also want to announce that this Saturday, COVID-19 testing will be available in Lansdale, at the Lansdale site on 421 Main Street. They will be open this Saturday, December the 12th, from 9 a.m. to 1 p.m., just Saturday, 9 a.m. to 1 p.m. And online registration will be open for this site starting at 7 p.m. Friday night at montgomery.org/COVID-19. And at the top of that page, click on the button that says County Testing Information. Our hospitals ask us to remind you that the hospital emergency rooms are not to be used for COVID testing. If you're sick, you are welcome to go there. But if all you need is to be tested, please, please do not go to a hospital emergency room. They are quite busy as it is. So please use one of our county testing sites or any one of the many private sites in the county. If you know that you've been exposed to COVID-19, you must self-quarantine. If you would like to be tested, you need to wait 5 to 7 days after your exposure. Getting tested more quickly than that will not be reliable. And even if you test negative after 5 days, you do need to stay in quarantine through 7 days as long as you have no symptoms. So if you have a negative test and you've had no symptoms during that 7-day period, then you can end your quarantine after the 7th day. Just as a quick reminder, the 6 county testing sites do not require a car to be tested. They provide testing at no cost. We will bill insurance if you have it. We do not require a healthcare provider's order, and we will test individuals of any age who need or want to be tested. We do ask you to make an appointment, and you can make those appointments beginning at 7 a.m. online, Monday through Friday, at montgomery.org/COVID-19 by clicking on that green County Testing Information button. And again, the appointments open right at 7. So if you get on before that, it's going to say that the testing sites are closed. Or if you get on the night before, it's going to say that the county testing sites are closed. But at 7 a.m. in the morning, it will open up for appointments. You can also make an appointment by phone at 610-970-2937. And the phone lines open up at 8:30 in the morning. But no worries, there are plenty of appointments available now that we've been able to expand our testing. If you make an appointment by phone, the language line is available so that appointments can be made in any language in which a person is most comfortable. Just want to remind everyone that it's not too late to get a flu shot, and December 6th through 12th is National Influenza Vaccination Week. We want everyone who is 6 months and older to get a flu vaccine. This will help protect as many people as possible from serious flu complications, and it will help keep people out of our hospitals. So this is one step that you can take to help protect our hospitals. We wouldn't be able to get as many people vaccinated without the help of some very important, trusted community partners. And today, we'd like to congratulate our friends at Acclamo, one of those very special community partners, who is receiving the Immunization Champion Award from the Montgomery County Immunization Coalition. Acclamo's outstanding support, dedication, and partnership has helped to get our Norristown and Pottstown Latinx communities vaccinated. Through the month of November, Acclamo helped the Montgomery County Immunization Coalition administer a total of 272 flu vaccines at their locations, walk-up and drive-through clinics. Thank you, Acclamo, and thank you, CEO and Executive Director Nelly Jimenez, for your continued passionate work in our community. So remember, it's not too late to get your flu shot. You can make an appointment at a county clinic at www.montcopa.org/flu. And you can also go to pretty much any pharmacy in the county. Just about every place is offering the flu vaccine. So please, everyone, remember that we are in a very, very serious situation right now. I know if we work together, we can suppress this virus because we did it in the spring. We can absolutely do it again. But it is going to take every one of us working together to keep this virus in check. The vaccine is coming. It will be here in a few months for the majority of the residents in the county. But we do have to get from here to there. And as the weather stays cold, it's going to be, I think, a bumpy and difficult few months. So please take this information to heart. Take this information seriously. And please use it to guide the choices that you make over these next several weeks, particularly as you think about how you're going to celebrate the holidays. The holidays create enormous challenges for us. I showed you the spikes that have happened after Halloween and Thanksgiving just this fall. So please take that information to heart as you decide what you're going to do over these next several weeks. With that, I will announce that our next virtual briefing will be next Wednesday, December the 16th, and be happy to take any questions.
We'll start our questions with Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioners.
Good afternoon.
As the hospitalizations continue to increase, will there get to a point where more hospital beds will absolutely be needed? And will the hospitals have this surge capacity to go above their licensed bed numbers by modifying other areas of the hospitals to create additional treatment areas? Has there been any discussion about that?
Yeah. The challenge for our hospitals is not physical space to put beds. The challenge is having enough nursing personnel, nursing assistants, all the other staff that are needed and required to put people into those beds. So it's not the physical space, it's having enough staff. And unlike the spring, where we were able to recruit staff from all over the United States who were willing and happy to travel to come here to help, every place in the United States is seeing similar surges. So there are virtually no personnel available to travel here to lend a hand. So our limit now is the number of staff that are available to care for patients.
Has there been any consideration of asking retired nurses and doctors to come out of retirement to assist in case you have such exorbitant shortages of doctors and nurses? Has there been any discussion about that?
Some of our hospitals are pursuing that strategy.
Okay. That's all I have right now.
Okay, thank you.
Thank you.
Next, we'll go to Todd Shepard from the Delaware Valley Journal.
Thank you, Todd. Commissioners, as always, thanks for making yourself available through this meeting. Commissioner Arkush, obviously hospitals are the big concern as you led the conference, started mentioning that at the beginning of the conference and are taking questions about it now. But I was looking at the state dashboard earlier today, and the problem seems to be more acute in Montgomery County than in other counties in the Southeast. According to the county's dashboard, it says the difference in average daily number of COVID-19 hospitalizations is plus 79 in Montgomery County. And all of your neighbors, with the exception of Philadelphia, are below 25. Is there some sort of explanation as to why it's so much higher in Montgomery County?
So there's a couple of issues. One, I alluded to earlier in the briefing that we have a lot more hospital beds in some of our surrounding counties, and our hospitals are getting patients from all of our surrounding counties right now. Oftentimes, an individual, they don't really think about what county they're in. They just go to their closest hospital, which is often across a county line. Many of our hospitals are right on our border. So our hospitals tell me that they're getting patients from Bucks, Philly, Delaware County, even a little bit from Chester and Berks. So I think that's part of it because I suspect, I haven't looked at all the counties, but as we have many more beds per thousand population here in Monco than Bucks, I think we have similar more beds than many of our neighboring counties do. So I think it's a combination of just having more beds and getting patients from those counties. And then, of course, we've seen a big increase in cases here in Montgomery County.
Excellent. Thank you. No further questions for me.
Thank you.
Next, we'll go to Jim Melwart from KYW.
You mentioned vaccine. Is there anything, any plans at this point on the county level of how vaccine may be distributed to whom and where?
Well, lots of plans are in place. What we don't have is any date certain as to when we will actually get vaccine or how much vaccine we will actually receive when we do get it. What I can tell you is that first tranche or cohort of vaccine that comes in will be for our hospitals and also for our long-term care facilities. And then we'll just have to wait and see what comes after that, how much and when. And we will use the prioritization that the Pennsylvania Department of Health is putting together, which is my understanding is very consistent with what you've seen in terms of the national prioritization. So in that, once all the healthcare workers and long-term care facility residents and staff are vaccinated, then the next group would be paramedics and EMS, other essential frontline workers, from teachers, grocery store clerks, pharmacy workers, critical infrastructure workers, people that keep the electricity lines working, things like that. So I think that's what we'll see primarily in that second group. And then the next group would be older individuals, I think probably over age 65. And likely in that group, people with particular underlying conditions, medical conditions that have known to be correlated with a much more serious case of the coronavirus. And then it'll go from there into the more general public. But what I don't know is when that's going to happen precisely and how much vaccine we'll get each time. And so, how long it will take to get everybody vaccinated.
Do you envision it being like I would go to my doctor? Would it be kind of like the testing that the county set up, or you would have sort of clinics or parking lots set up, or any idea how that might look?
We have some idea on how that's going to look. It's not clear that private doctors' offices are going to get a lot of vaccine, at least in the early days. And as I'm sure you're aware, there's some, particularly with one of the vaccines, really significant storage requirements for that vaccine in terms of ultra cold freezers. These are not the freezers that we have out in the garage. These are super, super cold freezers. They're very unique for this purpose. And so we believe that the majority of the virus, at least in the early couple of deliveries, will be coming either directly to hospitals or through the county. And then the county, we will be setting up delivery sites. So we will have points of distribution that we will advertise as soon as we know when we have vaccine available. There will be both drive up and walk up sites in order to be vaccinated. And it will be no cost. We have been assured that a mechanism will be set up so that individuals will receive a vaccine at no cost to them.
I feel like you may have answered this before, but I don't recall the answer and I couldn't find it. Will schools require a vaccine for children to return in person?
I believe, and I would check with the Pennsylvania Department of Education on this, but I believe they have said that it will not be required, but I would double check with them.
Okay, I'll check with them. And rapid tests for schools. I understand Montgomery County intermediate unit has tests that are available for schools. Is there any kind of, can you talk about how they're used or what they could be used for, what they could help this
sure.
stop out, whatever?
So we have been working with Children's Hospital of Philadelphia together with the Montgomery County Intermediate Unit to get some antigen tests into the county, separate from the tests that the Pennsylvania Department of Health has been distributing to counties. So we've been able to get a special or a separate number of tests in to use for the purpose of testing teachers in public schools. That is the pilot that has been rolled out. They were used last week to test teachers that were concerned about any exposures they might have had over the Thanksgiving holiday in an effort to make sure that they were available to teach in person if their school district was doing that this past Monday. So we are still in the process of working with the Pennsylvania Department of Health to come up with a mechanism to allow actual schools to have these tests on site in their school buildings, where they could be used to do some routine testing of teachers and some students, and also individuals who might become ill during the school day could be tested. We do not have enough of these tests, and we don't anticipate being able to get enough of these tests to do the testing that we would like to see, which would be to test every student on a regular basis. We're hoping that there will be an increase in the availability of these tests in the future, but right now we would not have enough. We don't anticipate having enough of the tests to routinely test students.
And bit of a hypothetical, but could those tests, you have enough of them, or could they be used to, if the PDEs put out the numbers of kids in school that a school would have to close for X amount of days if X amount of students have tested positive, would there be a way to use those tests to kind of circumvent that or prevent that forced closure?
No, I don't think there would be a way to use the test for that purpose.
Great. I'm good. Thanks.
Next, we'll hear from Ellie Silverman from the Philadelphia Inquirer.
Good afternoon, commissioners. Thanks again for having this meeting. I wanted to ask you specifically about an analysis the New York Times published today of U.S. Department of Health and Human Services data showing ICU beds nearing capacity across the country. That analysis also showed that Abington specifically is over capacity on ICU beds, and Norristown is close to being at capacity. And I wanted to know if that's something you're aware of as it relates to ICU capacity, and if this is a problem.
So our hospitals are very, very full. I met with our hospitals just this past Monday, met with all of the hospitals. And my recall, I did see that New York Times article this morning. My recall of the conversation on Monday was they were not quite as full as the article portrayed, but they are pretty full. It's important that everyone understand that our acute care hospitals here in the county are working together, and they are working collaboratively, and they are all willing to help each other out. And so that is very good news for the people in our county, that we've got, a great group of committed hospitals here that are working together, and one would be willing to take patients if another was full. So I would recommend that you reach out directly to Abington Hospital and to Einstein in Norristown to get those exact figures. But the big point is correct, that our hospitals are very full, and staffing is the critical point. There are not additional staff available to open up too many more beds, if any.
Thank you. And another question, have you been able to assess whether the 2-week school closures around Thanksgiving had any impact on reducing transmission?
Yeah, we are putting together some numbers now, looking at students and staff that have tested positive since then, and working on that. So hopefully we'll have something by next week. With the way the disease presents and the number of days that have to go by, it's really about 10 days to 2 weeks after any event before you really know what you're dealing with. So we should have a better sense of that by next week.
Thank you. That's it for me.
Thanks.
Next, we'll go to Deanna Durante from NBC 10.
Good afternoon. I was curious, your thoughts and reaction to the late news this afternoon that Governor Wolf has tested positive for coronavirus, and it appears that he's asymptomatic and this was part of a routine test.
Yeah. I was of course sorry to hear that, and I wish him the best and hope that he remains asymptomatic, and of course send my best wishes to his wife, the First Lady of Pennsylvania, Frances Wolf. I know they're waiting for her test result to come back. But I think it does underscore how contagious this virus is. As I think we all know, Governor Wolf has been extremely careful in his personal conduct, and I don't know if he has any idea where he got it, but it's just another reminder that we all need to be very, very careful. And as I said earlier, over 50% of this virus is transmitted by people who do not have symptoms. So it is vitally important that we all wear masks when we are around people who are not from our household, because any of us could be positive and not know it.
Are you in favor of more closures, more restrictions? You know, it's suggested right now, but when this started in March, we had the closures, we had schools shut down. I know that you want children in school. We had stores shut down, we had restaurants shut down. Do you think it's time to do something like that again, or is it that it's just going to be too little too late?
Well, as I've been saying, kind of this whole fall, the thing that would lead us to have to look seriously at closures is the rising hospital numbers. And, I think the challenge for our whole state, we're not just seeing high numbers here in the Southeast, but the hospitalization numbers across the entire Commonwealth are very, very high. And, unfortunately, there's not going to be, I think, another easy way to start to get these numbers down if people don't change their behavior. I would always hope that that could be done voluntarily. And every week, we try to give people the facts and the information and the guidance to make smart choices to help reduce the spread of virus in our community. But if people are not able to do that voluntarily, then we may find ourselves very soon in a situation where we don't have any choice but to support some closures.
This may seem like a crystal ball question, so I'm not sure if there is an answer because many of us haven't lived through this kind of situation before. But once you start with the vaccine, and I know you have to roll it out to the healthcare workers, and it has to be rolled out in a different way. It's just not going to be a blanket for everyone. At what point then do you start to see, the virus kind of roll back? I know it, again, is personal choices and people taking the vaccine, but do we have any research or any indication as to then once that begins in this area, how long we could see this virus to drop off?
Yeah.
So
that's a really great. Yes. No, I think we have some indication. The data that I have seen is that we will need to vaccinate around 85%, 85%, maybe a little higher than that of the people in a community in order to have enough people vaccinated that there is what's called herd immunity, where the people who aren't vaccinated are sufficiently protected that they would be unlikely to get the virus. So that's a lot of people. And remember that, at least the vaccines that are on their way to being approved, it's 2 doses for those vaccines. So we have a lot of work to do to get that many people vaccinated. And I want to just underscore again the safety of these vaccines and the efficacy of these vaccines. They seem to be really good at what they were designed to do. And so I'm hopeful that high numbers of people will be willing to take the vaccine.
Thank you.
Thank you.
Next, we'll go to Mary McKenzie from the Delaware Valley Journal.
Are you there, Mary?
Okay, we will move on and see if she can get her audio problems resolved. We will go to Manuel Smith from CBS 3.
Dr. Arkush, thank you for this opportunity. Following up on Deanna's question, on the governor, I know he had said he got the results of his positive test through routine testing. Is that, what do you guys do in the county? Are you tested routinely, and are you planning on switching things up as a result of Governor Wolf's side?
We are not tested routinely. We kind of made that decision way back in the beginning when testing was quite scarce. And instead, we have been very careful in terms of how we have been operating. So obviously, I'm sitting in my home office, and we have actually pulled our commissioner meetings back to virtual. We had been doing in-person commissioner meetings for most of the fall, but when we started to see this huge spike, we went back to virtual, and we've got now again many, if not actually the majority of our county employees working from home. So we have been following our own advice, and as a consequence, we have not been routinely tested.
Speaking of state connections, there had been rumor that the state is working on additional COVID-related restrictions, some to do with restaurant capacity, and that they had briefed local officials on that already, and maybe there'll be a public announcement sometime this week. Have you been part of those briefings? Have you heard that?
I've been part of those briefings, but I cannot confirm any of the details at this point.
Okay, but there have been discussions.
There have been.
Okay, and we've heard from some parents and educators basically about maybe almost second pandemic that's going on, and apparently some parents in Montgomery County are saying more teens died of suicide than COVID-19 in the county this year. Are you familiar with that statistic? Is that an issue, and is there anything being done to kind of address it?
Yeah. So I am aware of that statement circulating on social media. And first, I just want to be very, very clear that any life lost to suicide is one life too many. But we have not seen anything unusual this fall here in Montgomery County in our teen population. We routinely follow data on individuals that are between 12 and 18 years old that are Montgomery County residents. And so far throughout 2020, there have been 3 individuals who have lost their lives to a suicide. In 2019, there were 2. In 2018, there were 2. In 2017, there were 8. And in 2016, there were 0. So we are not seeing anything different this year. But having said that, I think what is true is that there are many, many kids and many parents who are under an enormous amount of stress. And it just underscores the importance of parents checking in with their children, asking them how they're feeling, giving them a chance to express those feelings. It's also really important for parents to model that it's okay to express those feelings with each other, and just making children feel comfortable, expressing that. We have a number of resources available, mobile crisis unit, we have a teen talk line. All of those resources have continued to operate and are very accessible to anyone in our community at no cost. So I know that so many people are in a very difficult situation right now, and I don't think anybody feels good right now. And but I do want to reassure people that it is still okay to not feel okay, and that we will get through this, and just keep those lines of communication open and reach out for help if you need it.
Thank you for that detailed answer. Just 2 more quick questions on vaccination. I know when the UK officials gave out the first vaccine there earlier this week, they quantified that as the largest vaccination campaign in UK history. I know you guys are still working on final numbers here in Montgomery County, but are you able to say that this will be the largest vaccination campaign county has ever been involved with?
I believe that it will be.
Okay. And that, I know that you are a physician. Are you planning to be one of the first, one of the first few ways of folks getting that? And do you plan on taking it publicly when it's available?
Well, I will absolutely take it publicly when it's my turn. I would be way toward the end to get the vaccine, and I would only get it earlier than that if others felt that it was important that I do so as a demonstration of my comfort level with the vaccine. But unless that would be felt to be helpful, then I will wait my turn, which means that it will be a while before I get vaccine.
All right. Thank you very much.
Next, we'll go to Kelly Co-Francisco with questions from reporters who couldn't attend today's briefing.
Thanks, Todd. We have one question from Kevin Tierney at More Than the Curve. He asks, if someone with COVID or believes they have it feels sick enough that they believe they should go to the hospital, what is the procedure to seek care from the hospital? And would you recommend they just go to the emergency room as normal, given the hospital's capacity issues?
Yeah, great question. So no, I would not recommend that they do that. Unless they are having life-threatening symptoms, severe difficulty breathing or anything along that line, then they should just call 911. But unless it's an emergency, first, they should call their own healthcare provider if they have one and explain to that person what their symptoms are, what they're feeling, and then take the advice of that person. If they do not have a regular healthcare provider, then the next thing would be to call their local emergency room. So, figure out the closest emergency room, give them a call, and they can do a lot of what's called triage over the phone and help you determine whether or not it's necessary to go to the emergency room. The emergency departments really appreciate those phone calls because they want to be prepared for you if you're coming and your symptoms are consistent with COVID-19, or maybe you've already been tested and you have it. So either calling your own healthcare provider first if you have one, or calling the emergency department that you're planning on going to before you actually show up, and then taking their guidance from there.
Thank you. We have no further questions.
Thanks, Kelly. We'll now go back to our reporters who are with us here today to check if anyone has any follow-up questions for the commissioners. In the interest of time, if you could limit it to a few of your most important questions, that'd be greatly appreciated. We're going to start with Jim Melwert from KYW, as he's already indicated that he has follow-up questions. If any of the other reporters do, please let me know by raising your hand in WebEx or sending a message in the chat. Thank you.
This is probably a quick one because you kind of already answered it with Deanna's question, but Dr. Farley in Philadelphia has asked neighboring counties to sort of mirror the restrictions that they have in place. In mind, what you already said to Deanna, are there any plans to do that?
Well, I believe the governor will be announcing some guidance soon. And we'll see what that actually ends up being, and then we'll go from there.
And a question I forgot to ask, we were sent video from the King of Prussia Mall, one of the food courts in the mall, with a irritated restaurant owner who says there's not spacing, there's not barriers, there aren't the rules at the King of Prussia food court that they're dealing with in the smaller restaurants. Is there an effort or any kind of policing for the mall? Is there? Have you seen that video, and is there any discussion of doing something about that?
I have not seen that video, but we'll certainly make sure that one of the teams from our Office of Public Health makes a visit out there. They've been out there several times since the mall opened back up, so we can certainly send them back out there to check that out.
And would the food court, would the same rules that apply to restaurants apply to a food court in the mall?
Well, the rules for them, I guess it depends if they have any kind of sit down or if they're just takeout. So it's hard for me to answer that without knowing the specifics for the restaurant. But the restaurant rules are all largely the same, and whether they're just takeout or whether they're takeout and sit down would be the differentiation there.
Well, I guess that let's say a restaurant that has the 50% or 25 or 50% in person, 6 feet apart, would that also apply to a food court type setting?
So if they can only do 50% if they're self-certified. And I mean, if it's just a regular food court area where there's multiple restaurants, kind of next to one another that are effectively doing takeout, then what applies in that situation is the density of the seating area around those or within that food court. And so those tables should be appropriately apart. And the capacity and the number of those tables should be within, I think, probably the 50% number of that space. But again, it's hard for me to answer because it depends on the capacity of that space. So I can't tell you what the exact number would need to be, but there are absolutely rules that apply in that situation.
Okay, right. So, but the capacity limits, there are capacity limits, and they apply to the. Okay, great. Thanks.
Yeah, definitely.
I'm good, Todd. Thanks.
Thank you, Jim. We haven't received any other indication from any reporters that they have any additional questions. So that concludes our briefing for today.
Thanks, everybody.